This class is Immune Function and Exercise, which is an emerging area of exercise science. So a lot of the research related to immune function has stemmed off of research on stress and what happens with stress on the body. We cover that with Class 19. And if you remember even back to our hormonal classes, we talked about the stress response that people have chronic epinephrine, norepinephrine, your sympathetic nervous system is activated, and lots of cortisol under stress. And we've also talked about the general adaptation syndrome, where when you are under an immediate stress, it sets off an alarm reaction and this big norepi, and cortisol jump, and then that remains elevated while you're under stress. And if the situation resolves, then it all comes back down to homeostasis. If not, then that puts that person at risk of chronic disease. And that's where people get sick, they get burnout, especially true in people that are in helping professions like therapy and other types of occupations, or someone who's a caregiver for a senior adult. So what happens when people are under, stress and immune function? Well, we've got a lot of barriers that help us prevent that. And so if you're a healthy person, your skin is a big barrier to infection. That's why you want to worry about things like cuts, or that you want to be up to date on your tetanus shot if you get a break in your skin. Your mucous membrane, which is why they always tell you not to touch your face, especially now this time in cold and flu season. So, but the mucous membranes also help, clear out unfavorable bacteria. So, and also inside we've got our neutrophils, our monocytes, natural killer cells, all these things that work inside to help keep us healthy. And you really don't even think about it unless you're sick. So the cytokines, we've talked about these throughout the course of the semester. There are 100 different cytokines. The major ones we've talked about: the pro-inflammatory cytokines, the interleukins, interleukin 1, primarily interleukin 6 is involved a lot with exercise inflammation. TNF alpha, how these contribute to inflammation that can lead to cardiovascular disease and diabetes. So there are actually some healthy cytokines. So there are some that are, that are good for you. But these are the ones that are typically the ones that, we'll talk about in an exercise that cause a lot of damage. Interleukin 6 goes up after exercise, and probably related to muscle damage. They not really understand why it peaks post-exercise, but it probably does have something to do with the mechanical stress to the myofibers, especially during high intensity and eccentric exercise. But interleukin also peaks in response to exercise, and it's probably due to muscle damage. And then you have your lymphocytes within the blood, and from your spleen, they're released from your bone marrow. And so again, people who've had their spleen removed, they can be pretty healthy, but they have a little bit lesser ability to mobilize their lymphocytes. But your lymphocytes are going to go up during exercise, and then they come back down to homeostasis. Your natural killer cells, these are involved with resistance to infections. They may help with cancer prevention. So they actually depress with high intensity exercise, and they also stay kind of low post exercise, but then they start to come back up to normal again. So what happens, and it was a common theme, is that long-term training appears to give a better effect. So the moderate exercise and consistent exercise, you tend to have a better lymphocyte and natural kill cell activity. So it can be important, especially for your risk of cancer, that these stay, that you have optimal levels of them.